What if I told you that the pill sitting on your nightstand right now, the one your doctor prescribed to keep you healthy, could actually be slowly stealing your memory? Not someday, not eventually, right now, tonight, while you sleep. That is not a scare tactic. That is a real concern that researchers have been raising for years. And yet, most doctors never say a single word about it during your appointment. Today, we are changing that. Stay with me because what you are about to hear could genuinely protect your brain and the brain of someone you love. Welcome back to Healthy Habits Daily. If you are new here, this channel is your trusted space for honest, research backed health information that your doctor just does not have time to explain during a 10-minute visit. And if you find this video helpful, and I think you will, please take a second right now and hit that subscribe button and give this video a like. It means the world to this channel and it helps us reach more people who need this information. Okay, let us get into it. Here is something that most people do not realize. Dementia is not always something that just happens to you out of nowhere. In many cases, there are contributing factors that we are unknowingly adding to our own lives. And one of the most overlooked contributors is the very medications we take every single day. Now, I want to be very clear before we go any further. This video is not telling you to stop taking your medications. Please do not do that without talking to your doctor first. What this video is doing is giving you the information you deserve to have so that you can have a smarter, more informed conversation with your healthcare provider. Because knowledge is the most powerful tool you have when it comes to protecting your health. Scientists have a name for the brain harming property that many of these drugs share. They call it anticholinergic activity. That might sound like a complicated medical term, but it is actually very simple to understand. Your brain uses a chemical called acetylcholine to help with memory, focus, and learning. When you take a medication that blocks or reduces that chemical, your brain starts to lose the very fuel it needs to function clearly. And the scary part is, many of the most commonly prescribed and over the counter medications in the United States have this exact effect. Some of them you would never even guess. Let us go through them one by one. The first one is a medication that almost every American household has in their medicine cabinet. We are talking about Benadryl, the allergy and sleep aid medication that millions of people reach for without a second thought. The active ingredient in Benadryl is diphenhydramine, and it is one of the strongest anticholinergic drugs available without a prescription. Research published in JAMA Internal Medicine followed thousands of older adults and found that people who used diphenhydramine regularly over several years had a significantly higher risk of developing dementia compared to those who did not use it at all. And here is what makes this particularly troubling. Many people take Benadryl not just for allergies, but as a sleep aid, sometimes every single night. If that sounds like you or someone in your family, please write this down and bring it up with your doctor. There are safer alternatives for both allergies and sleep, and your doctor can help you find them. The second medication on our list might surprise you even more because it is one of the most prescribed drug categories in all of modern medicine. We are talking about proton pump inhibitors or PPIs, medications like omeprazole, Prilosec, Nexium, and Prevacid. These are the drugs doctors prescribe for acid reflux, heartburn, and stomach ulcers. They are so commonly used that people think they are completely harmless. But research has shown that long-term use of PPIs may reduce levels of vitamin B12 in the body, and low B12 is directly linked to brain shrinkage, nerve damage, and cognitive decline. On top of that, PPIs can interfere with the gut-brain connection, disrupting the microbiome in ways that scientists are only beginning to understand. Many people have been taking these medications daily for 10, 15, even 20 years without ever being told about these risks. If you are in that group, it is worth asking your doctor whether you still need to be on a PPI or whether lifestyle and dietary changes might help reduce your dependency. Now, let us talk about a class of medications that a lot of people over the age of 60 end up taking: bladder medications. Drugs like oxybutynin and tolterodine are prescribed for overactive bladder, and while they do help with the physical symptoms, they come with a serious neurological cost. These drugs are among the most potently anticholinergic medications in existence. Studies have shown that long-term use of anticholinergic bladder medications is associated with a measurably higher risk of dementia, and in some cases, the brain changes associated with these drugs are visible on imaging scans. The reason so many seniors end up on these medications is understandable. Bladder issues are uncomfortable and embarrassing, and people want relief. But there are alternatives, including pelvic floor exercises, dietary changes, and newer medications with lower anticholinergic burden. Please have that conversation with your doctor because the trade off here may not be worth it. The fourth medication on our list is one that is going to be controversial because millions of Americans take it and believe it is protecting their hearts. We are talking about statins, drugs like atorvastatin, simvastatin, and rosuvastatin, which are prescribed to lower cholesterol. Now, statins are genuinely helpful for many people, particularly those who have had a heart attack or stroke. But here is something your cardiologist may not have mentioned. Your brain is made of cholesterol. Roughly 60% of the dry weight of your brain is fat and cholesterol plays a crucial role in the formation of synapses, the connections between brain cells that allow you to think, remember, and learn. Some research suggests that by aggressively lowering cholesterol throughout the entire body, statins may also be depleting the brain of a substance it desperately needs. Multiple studies have documented cases of memory loss and cognitive impairment in people taking statins. And while the research is still evolving, the signal is strong enough that it deserves your attention. If you are on a statin and you have noticed any changes in your memory or mental clarity, bring it up with your doctor and ask whether your dosage or medication type could be adjusted. Let us move to number 5. And this one is something that many people end up on during periods of anxiety, stress, or sleep trouble. Benzodiazepines. Drugs like Xanax, Valium, Ativan, and Klonopin are prescribed for anxiety and insomnia, and they work very quickly, which is part of what makes them so appealing. But they are also associated with one of the most striking dementia risk increases of any drug class on this list. A landmark study published in the British Medical Journal found that people who used benzodiazepines for 3 months or more had a 50% higher risk of developing Alzheimer's disease compared to non users. 50%. And the risk went up with longer duration of use. The problem is that these medications are incredibly easy to get onto and incredibly difficult to get off of. They cause dependency quickly, and many people end up taking them for years when they were only ever meant to be used for a few weeks. If you are currently on a benzodiazepine, do not stop suddenly. That can be dangerous, but do have a serious conversation with your doctor about a supervised tapering plan. Number 6 is a medication that has been around for decades and is still widely used today, particularly for depression and nerve pain. It is called amitriptyline, sold under the brand name Elavil, and it is a tricyclic antidepressant with extremely high anticholinergic activity. In fact, it ranks among the top drugs on what researchers call the anticholinergic cognitive burden scale. Long-term use of amitriptyline has been associated with structural changes in the brain and significantly elevated dementia risk. What makes this particularly concerning is that amitriptyline is often prescribed for conditions like nerve pain, migraines, and insomnia in older adults, people whose brains are already more vulnerable to anticholinergic damage. If you or a loved one is taking amitriptyline, ask your doctor whether a medication with lower anticholinergic burden could serve the same purpose. Medication number 7 is paroxetine, which most people know by the brand name Paxil. It is an antidepressant in the SSRI class, and while SSRIs are generally considered to be much safer than older antidepressants, paroxetine is a notable exception. Paxil has a surprisingly high anticholinergic profile compared to other antidepressants, and studies have specifically flagged it as one of the SSRIs most associated with cognitive side effects in older adults. If you are taking an antidepressant and your doctor has you on paroxetine, it is worth asking whether a different antidepressant with a lower anticholinergic burden, like sertraline or escitalopram, might be just as effective for your condition with less risk to your brain. Now we are at number 8, and this one is being prescribed at an alarming and frankly troubling rate in nursing homes and assisted living facilities across the country. Antipsychotic medications, drugs like quetiapine, risperidone, and olanzapine, are being used in elderly patients not just for schizophrenia and bipolar disorder, which they were designed for, but increasingly as chemical sedatives for behavioral issues related to dementia. The cruel irony here is that drugs being used to manage dementia symptoms may actually be worsening the underlying cognitive decline. These medications carry FDA black box warnings about increased mortality in elderly patients with dementia-related psychosis, and research has repeatedly shown they are associated with accelerated cognitive decline. If you have an aging parent or loved one in a care facility who is being given antipsychotic medications, Please ask the medical staff why, what alternatives were considered, and whether the medication can be reduced or eliminated. Medication number 9 is one that many people with depression, anxiety, or OCD have been on for years, and it is similar in profile to Paxil. Older tricyclic antidepressants as a class deserve mention here because they carry some of the highest anticholinergic loads of any psychiatric medication. Drugs like nortriptyline, doxepine, and imipramine are still being prescribed today despite the availability of newer, safer alternatives. If you are on any older antidepressant and nobody has reviewed that prescription recently, now is a good time to bring it up. Psychiatry has made significant advances, and there may be far safer options available to you that your doctor can discuss. Number 10 is something that might genuinely shock you because it is sold in every pharmacy and grocery store in America without a prescription, and most people use it without even thinking twice. Over the counter sleep aids, things like ZQL, Unisom, and many generic sleep tablets, often contain diphenhydramine, the same ingredient we talked about in Benadryl, or a similar compound called doxylamine. The difference is that when it comes in a blue allergy pill, people understand it is a medication. But when it comes in a soft gel labeled as a sleep aid, people treat it like it is harmless. It is not. Regular use of these over the counter sleep aids, especially in people over 60, has been directly linked to cognitive impairment and increased dementia risk. There are so many better options for sleep: magnesium glycinate, melatonin in low doses, sleep hygiene practices, cognitive behavioral therapy for insomnia, that it is worth exploring those with your doctor rather than reaching for a diphenhydramine based product night after night. And that brings us to number 11, which is arguably the most important concept in this entire video: what researchers call anticholinergic polypharmacy, which simply means taking multiple medications that each have some anticholinergic effect, even if each one seems mild on its own. Here is the thing about these drugs: their effects on your brain do not just add up, they multiply. Taking 3 or 4 medications that each have a small anticholinergic effect can create a total burden on your brain that is far greater than any single drug alone. And this is exactly what happens to so many older Americans who are on 5, 6, 7, or even 10 different medications at once. Each drug was probably prescribed by a different doctor for a different condition, and nobody sat down to look at the total picture of what all these medications combined are doing to the brain. This is why medication reviews, where a doctor or pharmacist looks at everything you're taking and assesses the total burden, are so incredibly important, especially after the age of 60. If you have never had a comprehensive medication review, that is the single most important step you can take right now to protect your brain health going forward. So, what do you do with all of this information? The first thing, and I cannot stress this enough, is do not panic and do not stop any medication on your own. Stopping certain medications abruptly, especially benzodiazepines and antidepressants, can be genuinely dangerous. What you want to do is print this video out, or better yet, bring your phone to your next doctor's appointment and say, I want to talk about my medications and my dementia risk. Ask your doctor to calculate your anticholinergic burden. Ask whether any of your current medications could be swapped for something with a lower cognitive impact. Ask whether you still need every medication you are on, or whether lifestyle changes might allow you to reduce or eliminate some of them. And if your doctor dismisses these concerns or tells you not to worry about it, find a doctor who takes them seriously. Your brain deserves that level of attention. Here at Healthy Habits Daily, we believe that the best healthcare is informed healthcare. Your doctor is your partner, not your authority. You have every right to ask questions, to understand what is going into your body, and to make decisions based on complete information rather than partial answers. The research on medications and dementia risk is not fringe science. It is published in major peer-reviewed medical journals and recognized by leading neurologists and geriatric specialists around the world. You deserve to know about it. Before I wrap up, I want to hear from you. Have you or someone you love experienced memory issues or cognitive changes that you suspect might be connected to a medication? Drop your experience in the comments below. Your story might be exactly what someone else needs to hear to take action. And if you learned something from this video today, please share it. Share it with your spouse, your sibling, your parents, your friends. You could be the reason someone protects their brain before it is too late. That share button is one of the most powerful things you can do right now. If you want to keep learning about how to protect your brain and your body as you age, make sure you are subscribed to Healthy Habits Daily so you never miss a video. We post new content regularly, and every single video is designed to give you the real, honest health information that helps you live better, longer, and sharper. Thank you so much for spending time with us today. Take care of yourself, take care of your brain, and I will see you in the next video.